All right, we are back for our, we saved the best for last. We saved the best for last. We have this wonderful panel here, and Chris really did set the stage for the conversation because, as he said, no one wakes up planning to have cancer, and all of us in this room are so fortunate and blessed to be healthy in one way or another, and we plan to stay that way. But we also live in this environment. We live in this culture where, you know, if I were to ask you if you had a drink last night, Friday night at the bar, you know, some hands would go up. If I said, you know, have you ever tried hookah? That's all the rage now. You know, people do smoke. You know, I enjoy a good cheeseburger, so, you know, I'm probably, well, I'll be honest, I'm not at my weight goal. So these are all factors that could potentially contribute to not being as healthy as I should, that could potentially, you know, set the stage for in something that I don't want. So that's what we're talking about, how to maintain our health, how to know our risk factors. And before we start doing that, I just want each of you to talk a little bit about where you are and what you do. And I'm going to start with you. Pull that off.
It's on. Hi, thank you very much, and I'm not so healthy today. Sorry. So if I take water or put a cough drop in my mouth, I'm sorry. I'm Sue Gapster, and if you don't know how to pronounce it, it's just like Napster, except Gapster. And I'm the Senior Vice President of Behavioral and Epidemiology Research at the American Cancer Society, where we look at risk factors for cancer as well as factors related to cancer survival and survivorship amongst people with cancer.
Okay. Dr. Paskett.
Good morning, everybody. I'm Electra Paskett from The Ohio State University. And I am a professor in the College of Medicine. I'm also the Associate Director for Population Sciences and Community Outreach in our Cancer Center, but I also direct the Center for Cancer Health Equity, which I have for the last 17 years since being there. My work really focuses on taking what we know about what causes cancer and figuring out how we're going to get people, specifically underserved populations, to do what they can do to reduce their risk for developing cancer, detecting it, increasing their chance for detecting it early, or living longer after they're diagnosed with cancer. And we have a lot of fun in what we do, and we cherish our community partners in all the work that we do.
Dr. Ashing, you're at City of Hope.
Yes. My name is Kimlin Ashing. I'm professor at City of Hope. It's a comprehensive cancer center in Los Angeles. I want to say that cancer is very, very personal for me. And so the sense of urgency is very, very real. Both my parents had cancer. So cancer came into my life when I was 12 years old, when my father was diagnosed with colorectal. And we know that colorectal cancer can have a long survivorship. And he was fortunate he did. But my mother was diagnosed with pancreatic cancer, becoming very common, and it's no longer a rare cancer, which is unfortunate, but lost her very early because late-stage diagnosis. So my work has always been to engage underserved and underrepresented communities, including immigrant community. I'm an immigrant myself from the Caribbean, Trinidad and Tobago. And so it's very, very important to look at ethnic, cultural, and linguistic issues, as well as socio-ecological context that we talked about earlier today. And so to bring that to the forefront of the cancer research, including the biological component, that we know that's very important, and given my family history, of course, I'm interested in the genetic component, but giving voice to advocates as well, because we know that it's important to bring all of our research to the patient population. That's why we do what we do. And increasing the competency and the skills of advocates so that they're clearly at the table as partners guiding our research. So that brings me to the work that I do. Thank you.
All right, so as I was saying earlier, this is a public meeting. It's an opportunity for those of us who don't hear these words every day to come and to listen to professionals and ask our questions. And so we're going to open up the floor to allow people to ask questions. But I first want to start with you, Dr. Paskett, because as I was getting to know you, and also I celebrate with you, you are a cancer survivor 2 times.
Three
Three
times.
times. 3 times cancer survivor.
Thank you, thank you.
So we celebrate that with you. But as we were talking and getting to know each other, we were talking about all these genealogy kits. You know, that is all the rage too. Everybody wants to know, who they really are, where they come from. They do these kits. But you were saying we really need to know, as a way of mitigating any kind of risk to cancer, we need to know, we kind of have to do a health genealogy and know who we are and where we come from that way. And that's a good place to start.
Right. I think it's really important. As I was mentioning, we're all caught up in 23andMe or Ancestry.com, et cetera. But really, we need to take a health family history also. So like Himlin, my father died from colorectal cancer, and my mother actually was a 4-time cancer survivor. So I knew early that I was at high risk for breast cancer. So when I was diagnosed at age 40, and so I started mammograms early because of that family history. And that, my first cancer was diagnosed when it was as small as the tip of my finger. You couldn't palpate it or feel it. And so, I really am convinced that really saved my life at that time. And so everybody needs to know what's the cancers in your family, your immediate family, and your grandparents. You also can do the same for other diseases, not just cancer. And then when you think about when you should start having your cancer screening exams, that plays a role in when you start and how often you have them, and even what tests you have. So it's extremely important to know that, and also to know your susceptibilities, for example, to risk factors for those cancers.
So, Dr. Ashing, though, not everybody, just because your mother had cancer does not mean you will get cancer. There are also, people that get cancer for which there was never any indication, as Chris was talking about with his wife. So how do we make sense of that and begin to think about our own health?
So only about 15% of cancers really have a genetic link. So 85%, we don't always know. But increasingly, research, the importance of research is letting us know that there are modifiable risk factors. So there are risk factors related to behavior. We know that smoking, absolutely not. Smoking is one of the #1 risk factors for cancers, and I think there are 42 cancers that are related to smoking. Alcohol, increasingly our research is showing alcohol is a risk factor. Diet, nutrition, physical activity, we've talked about that. All of these things are in some ways modifiable, but we have to take that into context in terms of neighborhoods, communities. If there are not safe parks for you to exercise in, that's not a thing to do because it's unsafe. So, we could cut up the rug, though, at home with our kids. Put on some music. I dance with my kids all the time. So there are ways, if it's a modifiable risk factor like physical activity, even if your neighborhood may not be the safest place, you can cut up the rug with your kids, with your grandkids at home. We know from the work of the American Cancer Society that eating a plant-based diet, and the American Association for Cancer Research and AACR, that eating a plant-based food is healthy, but we know that that's difficult to do because sometimes other foods are cheaper and more available, and we're busy, we're working. But we make small steps. So it may not be that you change your diet overnight, but saying, okay, once a week, I'll have a plant-based diet and try that. Season it up, and I'm from the Caribbean, with a little curry. Change the flavor a little bit. Make it interesting for you and your kids. And so there are things that you can do in the context of understanding that some of us may not be in the best neighborhoods in terms of access to healthy foods and vegetables and low-cost fruits and vegetables, that there are discrimination based on zip code and where you live and the availability. And so looking at, changing the community, inviting a farmer's market, making sure your policymakers are aware of your environment. That's why they're there. They're there to serve you. Have them make changes in the community. Go to the state legislators. Partner with educational institute like Morehouse. Let them know that they are part of the responsibility to change your communities.
All right, Dr. Gapster, I want to ask you, and I told you I was going to ask you this. I wanted to talk about alcohol because I enjoy alcohol.
It's my favorite risk factor, too.
Favorite risk factor. So I want to ask you about this. I'm hearing, okay, I need not, if we want to stay healthy, if we want to, reduce the risk for cancer, that always comes up. Alcohol, not to have it. What do we make of it? How serious? How serious should we take that?
I think you need to take it seriously. So as was mentioned, the number one thing is don't smoke. And I don't know how many of you are aware of this, but only 50% of the population in the United States is protected by smoke-free laws. So if there's anything you can do is help advocate for better protection for tobacco cessation and smoke-free laws in the US, in your communities that don't have that, because it remains the number one cause of cancer in this country. Number two, what do you all know is the number 2 cause of cancer in this country? Excess body weight. I'm not talking obesity, I'm talking overweight or obesity. So I like to change the dialogue. I want to talk about excess body weight. Number 3, alcohol. It blew me away recently when one of my colleagues at the American Cancer Society decided to do a paper looking at the modifiable risk factors for cancer in the US among adults. And what he found was that 19% associated with tobacco, about 10% associated with excess body weight, about 6% of all cancers, this is total non-melanoma, and excluding non-melanoma skin cancers, but total cancers among adults could be attributed to excess or to alcohol consumption. But what really floored me, 16% of breast cancers. Breast cancer is one of the cancers for which any amount of alcohol consumed on a daily basis your risk starts to increase. And so if there's something that people often ask me to do, because I get asked this quite a bit when papers come out about alcohol and cancer, I'm a woman, is there something I can do to help, potentially reduce my risk of getting breast cancer? It's, if you're drinking 2 glasses of wine per day, go down to 1. If you're drinking 1 glass of wine per day, maybe go to every other day. And so these are some really important things that we can do, and not saying become a teetotaler. We don't need to go to prohibition. But, it is something that we can begin to do, is just take a look, and as Electra said, do your own health history. Take a look at what you're doing and say, can I do something a little more, move more, sit less? Don't eat bacon every day. Maybe just eat it on Sunday morning. And just those are the sorts of things that you can ask yourself.
And what about things like hookah and electronic cigarettes? We're hearing that those are better than nicotine. Is that true?
So I'm not that up to speed on hookah use, but in terms of e-cigarettes, we don't really know the long-term health effects of e-cigarettes. But, we do see that the American Cancer Society does see as using e-cigarettes as one potential mechanism for current smokers to get off of combustible tobacco use. So if you're currently smoking cigarettes and you want to help yourself become a non-smoker, and your current approaches aren't working, it is one mechanism that you might want to try after working with your doctor on other smoking cessation aids.
Let's talk a little bit more because we've certainly covered know your history, know what's in your family, and then we've talked about staying healthy in terms of diet, exercise, non-smoke, don't smoke, and control alcohol. If not, don't drink alcohol. But I think we also need to talk about screening. So for those of us who go into the doctor, and all of us should receive medical care of some kind, we keep hearing about screening. So if you're a woman, we're hearing about, breast cancer screenings. Those keep changing. Every time I go in, it's like, well, we're going to do it this year, but you don't have to have it done every 2 years. And so talk a little bit about some of the screenings. What should we be looking to be screened for, and when?
I will talk about that, but I want to, for a half a second, since we're going to talk about controversial, which shouldn't be controversial, is HPV vaccination. So we know that HPV is associated with over 30,000 new cases of cancer a year. And if we could get our children vaccinated, we could eliminate 30,000 cases of cancer each year.
Now you're talking about the human
Papillomavirus, yes, vaccine is cancer prevention.
It's cancer prevention, okay.
Cancer
and
prevention.
at what age should people be getting the young?
So the Centers for Disease Control and Prevention recommend that boys and girls should get the vaccine at 11 and 12 when they're coming in for meningococcal and the Tdap shot already. The children can get the shot as young as 9, and it is approved up until just about 26 or so. It is one thing that you can do for your children so they never have to hear those words, you have cancer. And the vaccine is as safe as the other childhood vaccinations. It has been given in millions of people across the world, and it is as safe. And it is just a travesty that we are not vaccinating as well as we should. It's under 50% of the children in this country are getting vaccinated, and we have other countries that are up over 90%. So that's low-hanging fruit. Okay, now screening. So we have screening tests for breast, cervical, colorectal, lung, and prostate. There is some screening for skin cancer that should be done by a trained professional. And the same for oral cancers. That can be done by trained professionals. But as was mentioned earlier, it's about 3 to 5% of the eligible population who is getting lung cancer screening, which just is, ridiculously low. Prostate cancer screening has had a lot of controversy, but the message is that you need to talk to your doctor, know your risk factors, personal history, especially African American men need to get that screening. And it is being done sort of shared decision making and understanding the risks and the benefits. Breast cancer screening, cervical cancer screening, colon cancer screening. The guidelines keep changing for those. And I understand it's extremely confusing for the layperson. So breast cancer, we used to say get a baseline mammogram before 40, get a mammogram starting at age 40 every year. Well, that's kind of changed. But again, it depends on your risk. If you know your family history, if you know your personal risk factors, then an annual mammogram is for you. If not, talk to your doctor about every other year starting at age 50. Colon cancer screening, we recommend age 50. Again, if you're normal risk, and you have an option. You can get a colonoscopy every 10 years, a lovely thing, or you can do a FIT test or a fecal cord blood test every year. And then for cervical cancer screening, starting at age 21 to 30, it's a regular Pap test. But then starting at 30 to 65, you have the option of adding a co-test for HPV. And if you do that, it extends your screening interval to every 5 years. And the purpose of these, detect a cancer early when it can be treated, or for colon cancer, we can actually detect a polyp before it turns to cancer, and you have prevented a cancer.
And then the lung screening?
The lung screening, Yes, so there are certain guidelines for lung screening in terms of age and your smoking history, and I believe it's starting at age 50. And it is a CT scan, and so that is now gearing up and starting, hopefully increasing